Hello, good evening to everyone, and welcome to this interactive session. We're just waiting for Dr. Alok Arora to join. He'll join in another 2 minutes. Yeah, he's joined already. Yeah. So we'll start.
Yeah, sure.
Yeah, okay. So, yes, good evening and warm welcome to all the participants. Today we have two of our very renowned speakers, Dr. Sanjana Seth and Dr. Alok Arora. Welcome to both of you. Just like to give you a brief about both of our speakers. Dr. Sanjana Seth is a psychologist and a psychotherapist. She has more than 22 years of experience in clinical academics, basically teaching and administration. And she has even worked with large healthcare organizations of the armed forces and private sectors as well. And along with that, we have Dr. Alok Arora. He is a clinical psychologist. He's done his master's in clinical psychology, and he has a lot of experience working with specialists, special needs kids, basically parent counseling and autism. He's an expert in the autism field, and he's also the founder part of Care Foundation. So welcome to both of you, Dr. Alok Arora and Dr. Sanjana. And we're looking forward to an interactive session today. Okay, over to you, sir.
I think there is some communication from network issues from the end of Juliana. Yeah, hello, good afternoon, everyone. Am I audible to you all? Yes. So welcome to this session on understanding autism. We keep on getting a lot of queries from people that what is autism all about? What is autism? What kind of treatment? And usually when parents come to know, the moment the child is diagnosed with autism, they are in middle of a sea and they do not know where to swim, which direction to go to. Whatever somebody tells them, they keep on trying that, and there are a lot of myths associated with autism. So today's session we have kept to discuss all these.
Krishna Mummy.
I would request you all to keep yourself on mute, please. Yeah, thank you. So the purpose of today's session is to know a little bit more about autism and also to answer your queries, because there might be a lot of questions in your mind which you want to ask somebody. So we have, as Juliana has already told you, we have the renowned psychologist and psychotherapist with us, Dr. Sanjana Seth. She holds experience of more than 22 years now. And she is, she is a parent coach as well. So you can ask your questions related to autism or related to your own stress or anything, whichever you want to ask related to the topic. All right, so I would request Dr. Sanjana Seth to take over and please start the webinar for today.
Okay. Thank you so much, Dr. Alok. Thank you, Juliana, for both of you for your such kind words. So that really humbles me. And it's a great pleasure to be here with you all today afternoon, or rather evening. I would like to start by wishing all of you a very happy new year, because we are still in the first week of this 2023. And my wishes to all of you are a great strength and positivity in the coming times ahead, because I think my audience primarily comprise the parents, the students, and the professionals. And The parents need the strength and the positivity. The professional need the strength because who spend the time with these children giving intervention, it is not so easy. Similarly, the students who may be still deciding to come or not to come in this field, to work or not to work with children who are with special needs, autism. So they also need a certain strength and a positivity to take in the day-to-day challenges. So all the best to all of you. And Dr. Alok and I will do our best to answer your queries. Like he said rightly, that we do keep getting a lot. And so what I'll be starting with something very, very basic, because autism is something which comes under an umbrella term. So I'll be starting with that little bit of that umbrella term, take you towards that, holistic picture, and then we will move in step by step from there, and we will be taking the question answers at the end. And at any point of time, if you feel that I'm not audible, or you want me to speak in Hindi, or I'm only conversant in English, Hindi, and Punjabi, I can't talk in any other language. So please don't hesitate to let me know. And I would request Dr. Alok, you also to keep an eye out in case anything comes up in the chat, or, sometimes I tend to miss it. So you can always please bring it to my notice.
Sure.
So I would like to start with a little PPT. So just give me a second to share the screen with you people, please. Because if I may say so, I'm also a person with special needs to some extent.
Sure, ma'am, sure.
Yeah, thanks. So is my screen visible?
Yes, ma'am.
Yes, ma'am.
Okay, thank you so much for bearing with me. With practice, I have picked up quite a bit now. Okay, so as you can see from the slide, we are talking about special children. And if we look at the world around us, our own children, our siblings, or our nephew and nieces, every child is special, isn't it? But when I'm talking about special children, I'm talking about there's something little, something which is missing in them, or they have it in extra, which makes them little different from the regular children. So that is why the word special. For me, the connotation is special as in their strengths, also as in their weaknesses. And special also implies that these children will need a little bit more care than a regular child. That is where the word special children comes in. I would say that there is an umbrella term which is called developmental disability. And for me, a lot of parents come to me wherein yet a clear-cut diagnosis has not been given to the child, but a pediatrician writes down a term called DD, developmental delay, or they write down GGD, global developmental delay. And sometimes they just write ought and they write a question mark. So what happens in these kind of cases? A question mark comes more to the parent also. Sometimes if they have not been able to understand. Because a child who is very, very small, a clear-cut diagnosis at time is not absolutely that, hard and fast that it, yes, we do say notables, noted, notice. So then we begin more with the developmental facets. Developmental means the basic milestones, etc., what a child is supposed to achieve. So let's see what are these developmental disabilities or special children which I'm talking about. The first sign is that they are shown before a child turns 18. So anybody, these days I'm getting cases of autism who are coming to me as adults or who are in their 20s or in their 40s also. So it is not that they are autistic now, or they've got some special, disability now, whether of attention deficit or hyperactivity. It is just that the diagnosis has been done now. But when we talk about special children, usually they come under developmental disabilities, which do get reflected by they are from the time of their birth to the time they turn 18. And they usually present to us in an age-related manner. Even if you see, a mother is the first person to note any kind of difference in her child, even if it is the first baby and a mother is not so experienced. But you know, the way a child turns towards the mother at the nursing time, at the feeding time, or at the 3 months, the neck holding, or at the 6 months, sitting up, or then in the play school, you know, a child, they will play, say 2 kids are sitting or 3 kids are sitting and playing. So some children will, you know, they'll have a back towards each other or they will sit next to each other and be playing. But that is part of a regular childhood growth. That is called parallel play. That is shown in everybody. But somewhere a child may be not showing that much of liking to be part of that parallel play, or they may not be aware of that parallel play. So that goes in for your red flag. Similarly, when they come to a school, they may take time to adjust, they may take time to adapt, they may throw tantrum, they may refuse to go to school, or then later on also then the speech and the language may not be as well developed. By the time they come to primary school, they start having difficulties in moving from, say, play nursery to KG, after that the third, fourth class. By the time they come to the middle schools, even if no diagnosis has been given to them because they may have been mild features, then you start picking up from their academic performance as to how they are doing vis-a-vis their peer group. And then, of course, by that time, they are in middle school and senior school, where very clear-cut diagnosis comes to us. And that is the worst when it comes to us very late. I've had children who are in class 10 or 11, and there I'm telling them that their IQ is much below par, that they should have been in open school system. So it becomes very difficult for a parent to accept. And this is what I'm trying to tell you, that for every child, whether with autism, because the autism comes under this umbrella term called developmental disabilities, once you understand this, the foundation, you'll be able to move on to understanding autism in a much better manner. So that way, you understand that it is manifested before 18, present in an age-related manner. Usually these are severe chronic disabilities. What I mean by chronic is that these are lifelong, and there is substantial functional impairment. When we talk about functional impairment, we are talking about their day-to-day functioning independently in their age-appropriate manner. Child is able to brush by themselves, the child is able to wear the clothes by themselves, eat by themselves. It's a different thing if a parent does not let them. Some parents are very indulgent and they'll keep feeding the child. Not only indulgent, also to save time, that let's finish off with the work. So, but to understand that diagnosis of any childhood disability which comes is usually on the very substantial dependency on a caregiver. Moving on to basic causes, what can the basic causes can be? Primarily when we talk about causes, these are injuries to the developing brain or sensory organ. Now, injury does not mean that it has to be kind of, you know, absolute accident and all. Here, what I mean to say to the developing brain, that even when the neurons are firing, the nerves are getting formed in the brain, there can be a misfire somewhere. So instead of everything has to go like this in the brain, the wiring, sometimes it goes a little like this. So that is also while the brain is developing, and the brain of a child develops till at least 5 years of age. So at that time, till that time, any cause can come for the risk of autism. Then prenatal, natal or postnatal. any injury at that time. That means right from the conception to even when the mother is carrying, and of course at the time of the delivery or in the first 30 days of a child's birth, if there was any NICU admittance, if there was any fever, jaundice, surgery, or any kind of medical care which was needed, any of that can cause a developmental disability. Now, primarily, what are the child development domains? Because when the parents come to us, I've seen they just keep telling me कि बच्चा बोलता नहीं है, the child cannot speak. That is one domain, that is one facet. But I would like you to understand what are the other equally important domains for a child to develop. Whether the child has autism or the child has some other, concern under developmental disability. But these domains which I'm going to be talking about are common across the board for everybody. The first is the cognitive. Cognitive is the intelligence, a child's ability to understand, comprehend, problem solve, memorize, recall, learn. All these are part of cognition, which we also call intelligence, which we measure by IQ when we do the assessment. So in a very small child, we take an approximate, but as they start growing up and the parent feels that the child should be going in a regular school, then we also see. So autism has, at times the cognition, there is no impact, the IQ is absolutely fine, but at times the IQ varies where it is a little below par. So that is where problem solving and all becomes difficult. The learning or even going to a regular school may become difficult. Communication. When we talk about communication of a child development domain, what we mean is receptive. That means, is your child able to receive, understand, comprehend what you are telling? And expressive. Is the child able to express what the child's need is trying to tell you? What happens? Every parent, of course, focuses on the speech part. But what about your child? Is he able to tell you, even tug at your shirt and take you there, even if they don't point it, but at least take you from point A to point B to communicate? Or they can point out a picture that, okay, tummy ache, then a tummy ache, child crying there, ouch. Are they able to point out at a picture? Are they able to communicate, whether verbally, orally, pictorially, tactile, by touching? What is the way of communication? It is very important to understand, because accordingly the interventions are planned for the child. And accordingly, you will also be able to handle your child's issues properly. And communication style can be oral, it can be visual, it can be tactile. Similarly, learning also style can be the same for your children. Physical and motor. Is your child able to walk comfortably without falling, leaning to one side, has a good gait, a good body balance, fine motor skills, gross motor skills? All these, is he able to move from one point to another, locomotion? If he wants a glass of water or she wants a glass of water, is your child able to go from there or no? All these are part of functional independence, child development domain, which is as important as development of speech and language. Self-help, adaptive. A parent cannot be around all the time. So how much can the child do by themselves? So it is very important that, can the child do a problem solve? If from one room to another room the child has to go, or from one level up to down something has to be brought or carried, can the child manage? If the child is gone to a play school, adjusts, adapts, can recognize the school bag, the water bottle, etc. So that as independent as possible a child can be. These are some of the very important domains of the basic child development, irrespective of any kind of, the range or the severity or that thing. So whether it is autism or any other issue. The last domain of child development is social and emotional. In autism, Dr. Alok will be talking about in detail that we do know that the social deficit is there. We do know there is emotional hypersensitivity is there, where there may be, crying without any reason or crying excessively or not crying at all. It can be any of those things. So reaction which should be normal to us, they are normal to them. They are not normal to us, but they are normal to them. So these domains, once you understand, it will help you in moving forward, accepting as to what all can be done with the child, what are the kind of intervention, what are your expectations, what are the steps, what are the areas which need more focus. Because supposing physical motor, there's no issue. So you know your child can run around, play around, go to the park, do all those activities, motor, play, pottery, or painting, block painting and anything. Similarly, self-help, if the child is able to comprehend the communication, what you are telling them and what they can do, they will be able to learning how to button how to do their shoes, how to kind of get water bottle for themselves or a glass of water or a roti if they want from the casserole. So they start becoming more and more independent, and your parenting stress starts going down. Your that sense of as to responsibility goes down a little bit. That okay, I can take a breather. If I'm having a cup of tea, I know my child knows he's sitting with me. A glass is lying next to him. He will by himself take the water. Similarly, social, emotional. So if your child is mobile, adaptive, or even non-adaptive, take the child out everywhere. So then the more he's used to people around, more he's used to being taken around, the more accepting the child becomes. Now, what do you understand? What do you see when you see this picture? I would like to hear something from you, Peter. What do you see? Come on, I can't keep Dr. Alok waiting for so long. Somebody has to respond. What do you see?
Ma'am, maybe the child is trying to fish.
Yeah, the child is trying to fish. Absolutely. Anything else by anybody? So we're seeing, sorry, I can't hear anything. So there is a child who's sitting there. Now, when you look at it, this child, when the parent calls out to the child may respond immediately. Supposing we say, okay, Anna may turn her head and look at the parent. Supposing another child comes and sits next to Anna, and the Anna turns and says, "Here, you the fishing rod." She gives it happily. On the other side, a parent may be calling out Anna 10 times, the child may not respond. Other child may come, this child may keep looking self-absorbed. So what I'm trying to tell you is that a picture tells a story. Similarly, each child will arouse some kind of perception in you. Isn't it so? And developmental disabilities are like complex puzzles. We have to fit the pieces. It's not one size fits all. I know with Google Guru at your hand, everybody keeps reading up. It sometimes creates more worry, anxiety, confusion in your mind. But please remember that it's so complex. So we have to start completing the puzzle of understanding our child bit by bit, by putting in the pieces one by one, and more so where autism is concerned. So that all the domains that I've spoken about, if you remember them, it will be much easier for you to understand. So for somebody who may say, my daughter doesn't listen to me at all, how many times I have to tell her, I have to keep shouting. But whereas this child is trying to give the message, I'm not misbehaving, I have autism. Please be understanding. Just before I hand over, we move on to talk about autism in much more detail. I would just like to share with you that what are the consequences of development disabilities under which autism comes. It's debilitating in nature. Sometimes it goes up, it goes down, it may have a comorbidity, another medical concern can be there. So which can make the child, little healthy, unhealthy, with more hospital visits, less hospital visits, immunity issues. They can be impaired cognition. I've already told you intelligence can be impacted. Communication, of course, is impacted. Mobility also at times. Some children with autism still have very uneven gait. They may do pigeon walk, walk on their toes, or they may bunny hop instead of crawling, or they may even have in walking a balance issue because of some sensory. They may not like to wear a shoe or the heel or the toe, some surface which is touching them. And main thing to remember is that these children need a special interdisciplinary generic care and treatment. Generic care and treatment means as much as local care which is available to us, affordable care, interdisciplinary, whether from a pediatrician, neuro, psychiatrist, occupational therapist, child psychologist, behavior therapist, like that. And they need it over a period of time, because like I said in the beginning, these are chronic, these are lifelong, and nowadays with better diet, better parent care, better patient care, the lifespan of children with special needs is much more than what it used to be earlier. So with this, I would like to move on to Dr. Alok to take up from here for talking in much more about autism.
Thank you, ma'am. Thank you so much. Just give me a moment. I'll just share my screen now. I hope the screen is visible.
Yeah, it is.
All right. So you all might have heard this story in your childhood that there was some blind man who went to see the elephant for the first time. And since they were blind, they touched elephant at different parts. And whosoever touched which part, they just explained what elephant is like. Like somebody who touched the legs said that it's a tree. Somebody who touched the trunk says that it's a snake. So this is a very well-known story, and you might have heard about. And that's the story I always give in reference to autism. We as parents, we as professionals, and we as students, because we all three are here, the three people from all three domains. So whenever we see autism, we see from our own angle. A psychologist will see autism from own behavioral therapy or behavioral angle or cognitive angle. A speech therapist will see autism from speech angle. An autist will see autism from motor movements majorly, or the fine motors, gross motors, and all those angles. So everybody sees autism from their own angle. So what is autism? That's what we are going to talk about here today. It is what it is and what it is not. So it is a neurodevelopmental difference, different brain wiring, neutral variation. Now, I do not say it is a disorder. I always say it is a different brain wiring. We all have neurons in our brain. As ma'am has said that usually the brain development takes place till the age of 5. By the age of 5, it is said that nearly 70-75% brain is developed. And by the age of 11-12, it is developed completely. But the number of neurons in the brain remain the same right from the birth till the death. So by the time a child is born, neurons are in the same number. Okay, they are already there. It is just the way they communicate. That communication keeps on increasing. And that communication increases on basis of our own experiences, our own learnings from the outer world. So we start learning right from the birth. And from those learnings, that communication channel starts working in different sorts of communication. So that communication from one neuron to another neuron, whether it is sensory, whether it is cognitive, whatever communication is there, that we are calling here as different brain wiring, that we are calling as brain wiring. So people who are neurotypical, whom we say regular people who do not have autism, they have a set pattern of this wiring, but whereas in autism, you find it a different brain wiring. And the best part of it, the irony of it is, you find it differently in every child. So autism, you don't have two identical cases of autism ever in life. So I have been seeing kids for almost like 18, 20 years with autism, but I have not found any two identical kids. They might have identical situations or behavior patterns, but what are the reasons behind it? What are their learnings is different. So it is like I call it as having fingerprints. Like we all have, different fingerprints, unique fingerprints like this. Every child in autism is unique. Okay. So autism is a neurodevelopmental difference, a different brain wiring, and it affects every aspect of the person's being. It does not only affect speech or only affect cognitive skills or only affect motor skills. It affects every aspect of person being, how they perceive, experience, interact within themselves and interpret the world. So sometimes we just see that, okay, major focus, what I see for autism, when we go for therapies, I see that it is on speech and language. When I'm saying speech, that is speech and language, and motor skills and behavior therapies. But whereas the way person is interpreting the world, that also needs to be taken care of. Whereas how the person is thinking, the thought process, that also needs to be taken care of, because it affects every area. Okay. It is a minority neurology, and it, as ma'am has already said, that it is lifelong. We have to accept it. We can never say that child had autism or child was with autism. Yes, there are cases. I don't want to demotivate parents that your child will not come out of autism. I would rather say that autism symptoms will not be visible. We can manage autism very well nowadays. So there are chances, strong chances, that with right approach, with right therapies, and with right management skills of autism, the child can easily overcome with the symptoms of autism. There have been hundreds of cases where people are so much inclusive in the society that you can't, if you're meeting an adult who was showing some symptoms of autism in childhood, but after managing it well, an adult, you cannot even say that child ever showed some symptoms of autism. But we don't, it is lifelong, because it is a different brain wiring. You cannot go and change that brain wiring. So it is a lifelong thing. Okay. What it is not, it's not a learning disability. It is not an illness or disease. So usually we go for some kind of treatments where allopathy, Ayurveda, Unani, homeopathy, that okay, you take this medicine, you take this medicine. Now these medicines are there to control some sort of hyperactivity or to give some arousal to the brain. Those medicines are there, but there is no medicine which can claim scientifically that, okay, this will help us for autism to go away. Okay. It is not a bad behavior or willful defiance. Usually I see a lot of parents coming to us and telling, he knows everything, but he doesn't want to do it. He does only when he wants. Otherwise, he doesn't want to do it. He is a bad boy. You're a bad girl. She's a bad girl. So it's not about being bad. It's not about doing bad behavior or willful behavior. It is not, of course, it is not bad parenting as well. Sometimes there is a lot of social stigma around it, and it is because of mother not taking care of child or not giving time to child properly, or the parenting has gone wrong. Most of the parents, they blame themselves at times. So it is not a result of bad parenting. Another thing, autism. Whenever we talk about autism, we talk about children. It affects only children. Autism is with children. What happens? These children grow up. They become teenagers, they become adolescents, they become adults, and they live their life, you know. So, but there is one myth that autism means childhood disorder. No, it is not. It stays forever with them. It is, we need to create a system to support them lifelong, to help them manage their autism symptoms, and we can easily overcome it. Now, what is autism spectrum disorder? It refers to a neurodevelopmental disorder that is characterized by difficulties with social communication and social interaction, and restricted and repetitive patterns in behaviors, interests, and activities. So, social communication, interaction, and restricted and repetitive patterns of behavior. Sometimes you'll find repetition of behavior, sometimes you'll find restricted behaviors, interests, and activities. Earliest childhood symptoms, earliest symptoms. So how, as ma'am has already described a few, but how we say that earliest symptoms, which all symptoms are there? The child prefers to play alone, does not respond to their own name even at the age of 12 months. So for a parent, it is a warning sign, and there should be, I think, if professionals are here, I would request you to create as much awareness possible about earliest symptoms, because when this awareness is there, so on every platform, wherever you go, even if you are a school teacher or a therapist, whenever you are speaking to anyone, maybe you are traveling somewhere and you are in a you are traveling by train or by flight, and with your co-passengers, you can just take 2 minutes and talk to them about it. Create as much as awareness, maybe in some gardens or some malls, you can talk to people about it, especially to ladies who are going to be mothers soon, maybe the pregnant women, girls who are going to get married soon, or who have just delivered. We need to create the awareness about autism symptoms. Does not respond to their own name for at 12 months, that is a warning sign. Does not share interest with others, has flat or inappropriate facial expressions, so facial expressions are missing, avoids eye contact, is not comfortable by others during distress, does not understand personal space and boundaries. So all these symptoms are autism symptoms. These are the earliest symptoms. So how we diagnose autism is through some assessments, but alarming situations when a parent should visit a clinical psychologist or psychologist or to identify the autism, or a developmental pediatrician to identify the autism, whether it is autism or not, or any kind of developmental disabilities there. So these are the alarming situations. Now, if we go as per the standard of autism, now I have given you here, I have given you my own definition that it is a neurodevelopmental difference, different brain wiring, in a very simple language. But if we go as per standard definition of autism, it is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. See, all the areas, how they interact, how they, behave, communicate, how they learn and behave. So it impacts all the areas. So it is a developmental disorder. Okay. There are types of autism. Now, types of autism before 2013, we used to classify them in a different way. How we used to classify them as autism spectrum disorder, or usually it was called as autism, asparagus syndrome, child dysgenerative disorder, or pervasive developmental disorder. So this was till 2013, but in 2013, there was American Psychiatrists Association revised DSM-5 in 2013, which did not include these 4 subtypes of autism. Now, all types of autism fall under the umbrella category of ASD, autism spectrum disorder. So you will find a lot of books or text or information, and there are many parents who come to me and ask me about it. Sir, is my child having autism or ASD? Now they're confused between these two. So we need to understand that you will find all the references till 2013 as autism or Asperger's syndrome, but after 2013, it is ASD, autism spectrum disorder, which is an umbrella term. So all sorts of autism is falling under that. ASD is now the umbrella term for the group of complex neurodevelopmental disorders that make up autism. It is a condition that affects communication and behavior. Now, current classification of autism is of 3 levels: level 1, level 2, and level 3. We classify autism as 3 levels. Level 1, which is very low level or mild level, lowest classification. Those on this level will require some support to help with issues like inhibit social interaction or lack of organization or planning skills. So they would require very little support. Okay. Level 2 is the mid-range, which we otherwise call as mild. So mild moderate. So level 1 is mild, level 2 is moderate. So ASD level 2, in this level, individuals require substantial support and have problems that are more readily obvious to others. These issues may be trouble with verbal communication, having very restricted interest, and exhibiting frequent repetitive behaviors. So that is moderate. And now we are coming on level 3, that is otherwise known as severe. So on the most severe end of the spectrum is level 3, which requires very substantial support. Signs associated with both level 1 and 2 are still present, but are far more severe and accompanied by other complications as well. Individuals at this level will have limited ability to communicate and interact socially with others. So now here we have level 3 types of level of autism: level 1, 2, and 3. Level 1 requiring support, level 2 requiring substantial support, level 3 requiring very substantial support. And there are average traits of level 1, 2, and 3, which are mentioned here. Like, people may see me as awkward, but not disabled. So in level 1, at times, people will say, okay, there is some challenge with this child, but might not, at one glance, might not even come to know that, okay, the child is with autism. So that is level 1. Level 2, there are average traits, and level 3, there are different traits. Okay, so the difficulty of these children, the challenges of these children increase in every level. So mild, moderate, and severe. How we do the therapies? There are different therapy plans, therapy goals for all 3 levels as per their challenges, and we try to upgrade them from level 3 to 2, level 2 to 1, and 1 to no autism symptoms. So when we release a child from our clinic, saying that child does not require any more therapies, we teach the parents how to manage it, we teach the child how to manage autism, and the environment of child. When I say environment, now environment of child is the entire environment where child deals with the family members, relatives. It includes the supportive staff or caregivers who are at home, parents, teachers, their school management, including all. So we give training at every level to different to the child environment, how to manage child and how to manage the environment, and then we release the child. So level 3 goes into level 2, level 2 goes into level 1, and level 1 gets released from autism symptoms. Now, why autism occurs? This actually, I didn't want to bring in this slide. Whenever parents come to me, I just don't discuss about it, because there are research going on. There is no single one reason found so far that autism is because of this. Like, I went out in the rain, I got wet, it was cold weather, and I immediately developed cold and flu. There is a reason. Now I can immediately identify, why did I get this cold and flu? Because it was cold weather, I went out in the rain and I got wet. I have got headache, cold and flu, and maybe that has turned into sore throat or fever. There is a reason. We can identify, we can directly list down the reason. But for autism, it may be genetic, it may be because of some environmental factors, or maybe some patient and family related factors, but it is all maybe. It is not that I can write down on a piece of paper that yes, yes, autism has come in child because of this one thing. So now there is no point, for parents' perspective, I am saying, in digging into why autism has come. Rather, let's invest our time and energy on how to manage the child, how to support the child in overcoming his challenges. But however, I have included this slide here for information. Vaccination. Now this is under dispute. People come and say, is this because of vaccination? My child was perfectly fine before the vaccination happened. And after some sort of vaccination, the child has started showing the symptoms of autism. Now, this is under dispute. So far, there have been so many studies, but no right conclusion. No, we have not received to a conclusion that it is because of vaccination. Heavy metal toxicity, electromagnetic radiation toxicity, older age of parents. It has been seen when parents, usually the age of parents is about 35 or 40, chances of autism in child are more. But this is again, the study says chances are more. This is not scientifically or with research proven that yes, this is the reason. Genetic factors, yes, this might be one of them. Gastrointestinal problem in the child, prenatal and antenatal problems, forceps deliveries. There are many reasons could be, but there is no one way to just write down or just to find out so far that autism is because of this. So till the time scientists and researchers are working on those areas, I believe let us focus on how to manage autism rather than why autism has come. Now, in management of autism, there are different types of assessments first. So assessment of vision and hearing in all children, that should be compulsory. Assessment of intellectual disability in all children, that should also be compulsory. EEG indicated in the children with suspected seizures, episodes of unusual behavior and symptoms of regression, unusually poor sleep, and regressive loss of previously acquired sleep. So EEG is also done. Neuroimaging indicates in children with focal neurological signs, dysmorphic features, or regression. Okay, so neuroimaging is also done when we are seeing some sort of focal neurological signs or regression. Assessment of sleep disorder indicates when the sleep problems cause considerable stress and interferes with family function. So these are the assessments which should be done for all the infants. It is not for only for one, but go with this. Assessments of vision and Bera testing, hearing testing, eye vision testing, these all are like by default, these are being done for all the children who are born in hospitals. And then assessments of intellectual disability in all children, that is somewhere missing. That should also be mandatory. Now, there are 6 domains which should be managed in autism. So management of autism, there are different domains which we need to look into. Not only we need to look into speech and OT. Which are those domains? Core features, social communication and interaction, and restricted repetitive patterns. Now, these are the core features. Associated features are sensory concerns and sleep. Comorbid conditions, there could be comorbid conditions of ADHD, attention deficit hyperactivity disorders, and anxiety. Education, so special services, inclusion, that is a special educator, shadow teachers, inclusion of them in the mainstream schooling, curriculum, and provisions. Adolescent sexuality and vocational training, finally. So these all are the areas where we need to support. That's why I was telling you in the beginning that it is not only about childhood. It is not only about, speech and language, or sometimes parents say that child does not speak. Once the child starts speaking, everything will overcome. They just say, because he is not understanding us, because he's not able to speak. So, my dear friends, there are, I think, thousands and thousands of people in the world who are under the category of MR, but they have proper speech. They speak. But what they speak, we do not know. We don't understand. They just speak meaningless. So only by bringing in speech, everything is not going to change. We need to take care of social communication, interaction, restrictive and repetitive behavior patterns, sensory concerns, motor issues, sleep disorders. We also need to see into the comorbid conditions if the child has anxiety, ADHD, attention deficits, and all. And then we also need to look into the education part and provide support in education. adolescent age, if the child is going towards teenage and crossing 10 years, 11 years, puberty. So that time we need to look into the sexual issues also. And then vocational, train them into something. It is not only rakhi making or envelope making, or making some drawings and having some small exhibitions or stalls in some exhibitions. It's not about that. We need to create some softwares for them. We need to, which can support their challenges. We also need to create some employment as per today's needs, where they can earn respectively and be independent, financial independent in life. So management principles of autism. I hope you all are with me. I hope people are not sleeping. It's not getting too bored.
Not at all, doctor.
Right. Thank you. All right. So management principles. Intervention should begin as early as possible. So early intervention, that's why I said, let us take, if we are spending time here in this webinar, you all have taken out time from your busy schedule. First of all, I thank you for that. But let us, all of us, take an oath that in our lifetime, we will educate at least 100 mothers or 100 parents about autism. So if each one of us, we are 67 right now, if we say 100, 6,700 people, we are creating awareness about autism, and that too about the signs of autism. I'm not asking you to go and give this whole details, and no, it's just the symptoms of autism. The moment, if they know symptoms of autism, the moment symptoms occur, they can immediately approach to professionals. Immediately they can reach to professionals. So early intervention can take place. And early intervention is always, because that is the time when neurons have started communicating to each other, and that communication wiring has started. Now, as early as possible, if we start giving the right, injections to that wiring can be corrected or can be managed in a better way. Okay, so early intervention should begin as early as possible. Definitive diagnosis is not necessary for intervention. Intervention should target the core features of autism. Again, parents come to me and they ask me, sir, is my child on mild autism, or is my child on severe autism, or what is the diagnosis? Trust me, there is no set standard. It's not like medicine where I have to give you 5 mg if child is on mild or level 1, or I have to give you 10 mg twice a day if the child is on level 3. So there is no point in getting into the intervention that where the child stands, what it is. We need to see the child's challenges and strength and work on them. So we need to list down all the challenges, all the strengths, and work on them. Not only about challenges or weaknesses. The environment also we need to keep positive environment. Usually, I see at child therapy, pediatric rehabilitation centers, child therapy centers, or at home also, parents, even, the entire environment of child, teachers, parents, siblings, or the therapist, they always talk about child's challenges. They always talk about the child does not do this, child does not do this, child does not do this. We tend to ignore the strengths of the child. But whereas if you take the strengths of the child and then create plans on challenges, you will bring much, much faster development in child. Trust me. So, and the IPs or the plannings which we make, IP stands for individualized education plans. So these IPs and therapy plans or goals which we set, if we take care of, if we include the strengths of the child in that, definitely we see the faster and much induced development. So we need to see, don't get into why autism has come, don't get into why autism, which level of autism it is. Just get into what are the challenges of child, what are the strengths, and let us plan. What we need to plan is a specific goal, appropriate plan, evidence-based, and structured plan. These are the four areas, core fundamentals which we need to use. Team approach. Management of children ASD should be provided through interdisciplinary teams. I see that some parents are running to one therapist to another therapist in two different locations. So we are taking occupational therapy at one place and we are taking speech therapy another place. But both of them are running different goals. It is like your child is in 9th grade or 10th grade, where the child is learning English of 5th grade or mathematics of engineering. It is like that. The sync is not there. The coordination is not there. Both the therapists, they do not talk to each other. And when therapists do not talk to each other, they do not know what are the goals we are setting for the child. And child is confused. Child is going at one place to another place. So the right model, as per my opinion, is an interdisciplinary approach. The assessment should be done by all the therapists, be it speech and language pathologist, be it a clinical psychologist, be it an occupational therapist, be it a dietitian or special educator. And then all of them need to have a team meeting, discuss with each other, and then set and plan IEP, single IEP, not 10 IEPs of 10 different therapies, single IEP, and work towards it. The pediatrician or developmental pediatrician can also be a coordinator for this. That is my recommendation. Or a clinical psychologist can also be a coordinator of this. So the team should include pediatrician, developmental pediatrician, child neurologist or psychiatrist, clinical psychologist, occupational therapist, speech and language therapist, special educator, dietitian. Oh, I've repeated special educator 2 times, I'm sorry, dietitian, and a social worker or a psychotherapist a counseling therapist, counseling psychologist, sorry. So all of this together, they need to work, in the team approach to manage it in a better way. Specific interventional models, generally a combination of therapies and interventions required to address individual symptoms. Applied behavior analysis is another standard model, where we apply a behavior and to do the correction, a lot of record keeping and data taking. ABC model is also one of it, that is antecedent, behavior, and consequences we note down. Structured teaching, that is the treatment and education of autistic and related communication handicapped children, the TEACH approach. Developmental relationship-based flow time approach, and integrative programs use a combination of strategies within the treatment program, like social communication, emotional regulation, and transactional support, secrets. So these all are the different internationally, the different approaches, different models which are being used internationally, and we can use mix of them as well. We are not going much into detail of it because we do not have that much of time right now with us. So ideal intervention program should be based upon the child's chronological age. The program should always be, it should be the age appropriate program, developmental level, specific strength and weaknesses, family needs. And minimal intensity should be 25 hours per week. Just by 45 minutes of therapy session where child was cranky for first 15 minutes, child was not, in mood of taking the therapy, only 30 minutes of therapy thrice a week is not going to help us much. So minimum 25 hours per week. Now 25 hours per week, if it is not practically possible to have it with professionals or therapists, parents can become co-therapists and they can support children. Here, I work with an organization called JKP Healthcare, which is Jai Kripalu Prabhu Care Foundation. So in JKP Healthcare, we have a lot of training programs for professionals on autism and for parents as well. So there we are training a lot of parents. In the year 2022, I'm proud to say that we have trained 323 professionals and 117 parents across the globe in management of autism. So parent education and home components are also important, but not a substitute to a professional intervention for each child. So it is like parents education and home components. Home components, when I say home therapies, which parent is delivering it, hybrid model therapies where the therapist is guiding the parent on online and then parent is delivering it, and educating the child environment, and not only the parent but caregivers and grandparents all are being involved in it. So all these models are also very important, but they cannot be a substitute to a professional intervention which the child needs. Now we are coming to another interesting point here. I think we all need to wake up. There is very less spoken about it. Virtual autism. We see lots of cases, especially post-COVID stage, where we are seeing children are on virtual autism, not on classic autism. Now, what is classic autism? Autism, which we have been talking about so far, is also being named as classic autism. And then there is another type of autism, which we say virtual autism. Now, virtual autism is not by birth. Classic autism is by birth. Virtual autism is because of some environmental factors. So what is classic autism and what is virtual autism? We need to do the environmental study of the child at the time of screening of the child. That's a message to professionals especially, and parents as well. When you go for any sort of screening of child for autism or any sort of assessments, you need to inform the professionals about the environment of the child in the first 6 months, 8 months, or 1 year of his age. What was the environment? So what the parents, how much time parents were giving to the child, and virtual autism, what are the reasons for it? The symptoms are more or less same, but as you can see on the screen, in virtual autism, you will find, the challenges majorly in social and behavior communication, the interaction, but you will not find much of the challenges in motor issues or sensory issues. You will not find. Speech and language might be a bit delayed. Yes. Cognitive skills, again, there might be a concern with cognitive. Now, why virtual autism happens? Again, there is a debate on it. Majorly, people will say it is because of screen time. Let us take a short break of just 1 second or 3 seconds. And I want to ask you, how many of you agree with this, that virtual autism happens because of screen time? The cause of virtual autism is screen time. You can just give me your inputs on the chat box, quick. Agree? Not sure? Okay. Only 2 people? Yes, maybe, not sure, agree, great. All right, thank you. So most of us agree that virtual autism is because of screen time, but I don't agree with it. Screen time is one of the reasons for virtual autism. But why virtual autism happens? Let us again.
सर अभी आपने इससे पहले हमें एक्सप्लेन किया कि ड्यू टू एनवायरमेंटल फैक्टर है, नॉट ड्यू टू द स्क्रीन, और
Yes.
अभी तक वाकई हमें यही पता था कि स्क्रीन की वजह से है, लेकिन कंसेप्ट क्लियर हो गया आपकी तरफ से। थैंक यू।
Thank you so much. Thank you. Virtual autism happens because of the, as we have discussed first, let me give you the brief. As we have already discussed, that neurons are there in brain, the communication of neurons, the wiring starts building up, and it grows, it grows complex with time. When the child grows old, more he is exposed to the environment, more he learns. A child of age of 3 years usually asks 200 questions in a day. Now, 200 questions when the child is asking, and we are giving that input. What it is, why it is so, what we do with this, why you are going out, why our car is red, why the wheel is turning like this, why you are taking this turn, all those questions child asks. And every answer we give him is the input for him. And that input develops his communication. Now, when this communication is one-sided, when this communication is, yes?
Yes, sir. I have one question that is any of the environmental things like feather collection or looking in one direction only for the like half an hour or 1 hour continuously, is that a part of the virtual autism too?
We will take this question in the question answer session. First of all, Amrita, is that okay?
Sure.
Yeah,
Yeah, sure.
we'll
Thank
share.
you.
I'm just going to wind up in next 15 minutes and then we will take it for sure. Okay.
Okay, sir. Thank you.
So in virtual autism, what happens is when this child is learning from the environment. Now, when we are restricting his environment by giving screen time, is also there is restriction. When there is one-way communication, child is only seeing things, but child is not able to ask his questions. He is not getting those inputs. That time we see that the autism, the virtual autism symptoms starts occurring, and symptoms are more or less same in virtual autism. Now here on the screen also, you can see the two images, one child with screen, you cannot, and another child is just covering ears. Maybe she has some sensory issues, auditory sensory issues. Look at the eyes, the way she is keeping, look at the facial expressions. You can see the difference. One child might be on autism, another child could be on virtual autism, where the child sitting position or lying down position is perfect. The holding, the way child is holding the mobile phone, you can see the fingers is perfect. There is no challenge in it. Eye contact, the eyes are contacting directly on the screen. So that is also not a problem. Facial expressions is also not a problem, but still child might have symptoms of autism. Now, if I see the next screen again, here we have two screens where one child, we are teaching him the emotions sitting on the left hand side, and the other child on the down, if you see. So the first child is example of autism where eye contact is not there. You see the sitting posture, you see the finger movements is totally different. So child is showing, the disorder in all these areas like eye contact or emotions or finger movements, sitting positions. Whereas the other child who's not listening, the mother is trying to call, but child is not listening. But holding the fingers properly, sitting position proper, eye contact giving somewhere, not listening to the parent, not responding. This could be the sign of virtual autism. So screen time can be one of the cause. Now, why it is the cause? It is not only responsible. Responsible is what the child, when the child's brain is developing, when those neurons are developing their communication, that time the child did not get two-way communication. The child was isolated and child was only grasping whatever he could. The environment was not developed that much. So child did not get the right environment to develop, to learn and develop it. So it could be because of screen time, because in screen time, what happens is child gets only one-way communication. Whatever is shown on the screen, child is just seeing that, but child is not able to ask the questions. So again, one-way communication, so that could be one of the reasons. Parent screen time could also be one of the reasons. Now, in the COVID times, when it was lockdown everywhere and people were working from home, parents both were occupied and the work pressure had increased rather than decreasing. The work pressure, the working hours were increased. People were working almost like round the clock. And in those times, parent screen time became responsible for child's virtual autism, not only child's screen time, because parents were occupied, child did not get the right inputs which he was supposed to get at that time. Okay. Now, this is the communication, a brain mapping image of typical brain and autistic brain, the communication. If you see these green lines which are showing the communication, so neurons are communicating with each other. Like when I'm talking to you and suddenly if there is a doorbell which is ringing, my auditory senses, the information comes to my ears that bell is ringing, auditory senses. Okay. Now this, from ears, it goes inside the brain, from one neuron to another neuron, that bell is ringing. Suddenly my brain sends that neuron sends information to another neuron that I need to get up, and that command I get and need to open the door. But same time, I'm delivering a lecture here. So another neuron is communicating, no, you are delivering a lecture, you cannot go, let the bell ring. Same time, third thing goes in mind that, okay, there is somebody else who will open the door. So this is the complex way. But autistic brain, what happens is unusual rapid growth of the communication. So communication is coming here, communication is going, but neurons are communicating, but not in a set pattern, like bell is ringing, and then I'm taking a call that I need to get up, I need to give a pause or not. I'm within nanoseconds, this all process happens. But with brain, which is with autism, the challenge is that they have unusual rapid growth in infancy and early childhood, are typical patterns of connectivity which develop. So early childhood, if we start training the brain, we can control this up to a level. That's why early intervention is important. Now, in autism, there are different areas of childhood development. It is not only, again, I'm stressing on this, speech and language and OT and behavioral therapy is not the solution. We need to look into each aspect of it, because when brain develops, there are different areas we need to look into. So cognitive development of the child, spiritual and moral development is also, so it is for the comprehensive development of child. So cognitive development, spiritual and moral development, language development, gross motors, fine motors, self-help and adaptives, social and emotional development. So message to all the professionals who are here, who are managing your own pediatric rehabilitation centers, message to you that try to bring in all these areas, try to bring in experts from all areas in your center. And the message to parents is, please look into that your child is getting all those development in all those 7 areas. Okay. Now, the last, I will not take much time on this, but I just added this here because I think that it is very, very important that behavior is communication. Because major issues which we find in child and which we want to be corrected is behavior. We say that child does not be, when we go in society, we feel embarrassed, we cannot take child anywhere, we cannot go with child in a mall or for shopping, or in a wedding ceremony or anywhere in party, because child becomes cranky or has meltdowns or shows tantrums, which we say usually. So please understand, all behavior is form of communication. Everybody communicates through behavior. An infant may cry when she or he is hungry or wet. Just like an adult may yawn, some of you might be yawning now, tired of this long lecture, when he is bored at work or bored of lectures. Adults and children are communicating something through their behavior during every moment, in every day, even if they are not aware. So without even being aware, we are communicating. When I'm going on the road, you are passing from the other side, we see each other and we smile. I just give a smile to you and pass. Now that is also a communication. And I am walking on the road, you're also coming from the other side, and I look at you and I turn my face and walk. That is also a communication. So similarly, these children, they show behavior to communicate something. Nothing happens all of a sudden. Nothing happens without a reason. The child was sitting and suddenly my child starts crying. Suddenly my child starts, starts screaming. So nothing happens suddenly. There is some sensory input needed. There is some issue with the child. There is something the child wants to communicate to you. We need to understand what child wants to communicate to us. So for that, we have an ABC model. Maybe on some other day, we can talk about ABC model, which really works well. Antecedent, behavior, and consequence. We can create a diary for a child for 1 month, and we can read every behavior and find the patterns into it. What child is trying to communicate with his behavior. All right, not taking much time with this, I will end up today. I was given time till 5 o'clock, but I'm sorry, I've taken almost 13 more minutes. And now the time for questions. So there are some questions on the chat box. But prior to that, I would like to invite Dr. Sanjana Seth. Ma'am, please be with us for the question answer session.
Yeah, I'm still there.
Oh, great. Yeah. So we are open for questions now. There is somebody who was asking a question about virtual autism.
Yeah, Dr. Mir, I think he has raised his hand since quite some time. Dr. Mir, am I audible? You can ask your question, please.
Okay, there was one question before in middle of virtual autism talk.
Yeah.
That the child is sitting and staring in one position for a longer time. Is this virtual autism? Right? This was the question, right?
Hello.
Amrit?
Hello.
Yeah, this was your question.
Yeah, I'm still there, sir. No, the question was that not only that the child is sitting in one position and looking forward in a single position for a longer time, but one more thing is that he is interested to collecting some feeders like that. Means, like I personally know that child. He is just of 6 years old, and he is my friend, some so close friend's son. So he is behaving like that. But the doctor says that he is not a like child of the autism perfectly. He is a hyperactive, but the most of the symptoms what you discussed today, they means like 99% of the symptoms are similar. Yeah. So is that the like collecting something, feathers, seeds, leaves, and looking for a longer time in a one direction? Is that a kind of virtual autism? That's my question.
Okay. See, we need to look into it by doing a detailed assessment whether it is autism or not. Okay. Once we know it is autism, then we need to look into whether it is classic autism or virtual autism. So first of all, when your doctor whom you are visiting is saying it is not autism, I don't want to comment on it, and without doing a detailed assessment, I'm not in right position just by listening to a few traits that it is autism. Once we are sure about it that it is autism, then we need to do the environmental analysis of that child of his early age, right? 0 to 2 years. What was the environment? What kind of, whether he was exposed to screen, whether he got the right inputs from the environment, how much time parents were able to dedicate to the child, was the child left alone with the caretaker or electronic toys or video games. All those environmental assessment we need to do. Once we do the environmental assessment, we can reach to a conclusion whether it is virtual autism or not. Again, in the environment, along with environmental assessment, we also need to look into whether the child has some motor issues, fine motor, gross motor issues, or is the child's autism. Because in virtual autism, major concerns are cognitive. Major concerns are about behavior. There are lesser or rare concerns which are physical concerns or motor movements or motor issues. Okay. Clear, Amrita? Okay. And if anybody here wants a detailed assessment or discussion with us about a particular child in the the assessment, so Dr. Sanjana said and me, we are available with JKP Healthcare. You may contact on the numbers which you have received from Juliana. Juliana is the coordinator for us, or Dr. Rahul Surana, who's my junior. He's a psychologist. So you may contact on to both of them if anyone wants to have a detailed assessment with us. Yes, we have. I can see another hand, Praveen. Praveen.
Yes, sir. Good evening. Good evening, sir.
Good evening.
Are you able to hear me, sir?
Yes.
Yes, sir. Sir, presently I am working as a special educator in one of the school. So where I have observed that one child is autistic.
Okay.
So, but his parents are not willing to accept that the child is having that autistic disorder.
So the major issue with us in India, I see that acceptance level is very low.
Very less, yes.
I see that acceptance level in tier 2 and tier 3 cities are still more than tier 1. Trust me, that is that's a contradictory statement I'm making, and maybe Dr. Sanjana will not agree with me. But I see the acceptance level when I go to city like Nasik or city like Nagpur, Maharashtra, or when I was there in Cochin last week, I see the acceptance level was much higher than the acceptance level in Bangalore and Mumbai. Okay, it's a contradictory statement, though the awareness is more in metro cities and less in tier 2 and tier 3 cities. So here what we can do is we can share some like I have shared the symptoms of autism chart with you. So we can Google it out, share some screens with them, share some information material with them. We are also, I'm also in the process of writing a book on autism in Hindi.
Okay.
Right now in Hindi, which I tend to translate in other vernacular languages also on autism, which I'm planning to release on April on Autism Day,
Okay.
2nd of April. So I would share that copy with you, which you can share with them, or find out till the time. Let's not spend waste much of time, because early intervention is important. If you've seen some signs of autism, if you want me to speak with them, I'm readily available. I can speak with them and guide them.
Okay, sir. Okay. Okay.
You can connect with me. Okay.
Dr. Alok, if I
you.
may add here, Parveen, for you,
Yeah.
if I can add in here, this is also for all the others.
Okay,
You know,
please.
psychoeducating a parent about certain aspects of child development are very important. Like when we were talking to you, Alok, also what he has explained. Because sometimes if we tell them that it is, like autism, and then the parents may go on a back foot. But if you guide them that, there are certain features which, if, you get them at least shown to a pediatrician, so you tell them it in such a way that does not come across as very labeling the child, very threatening to the parent for the diagnosis. Because now you've seen it, you're a special educator, you understand as to what exactly are the red flags, the signs, and what is the importance of early identification and early intervention. So all now you have to do, communicate in such a manner to the parent where they do go, if nothing else, even if they go visit the school counselor, or if they visit the, a child psychologist, or a pediatrician. So you just have to guide them towards it and see, I feel this is it. This is showing as the weakness in a child. So, to help him overcome or to give the right intervention, because the child is at the right age or the stage, why don't we do this? So instead of saying, why don't you can always say, why don't we do this? Because we show that we are a team.
A team, yes.
I mean, the best for your child.
Right.
So if you try that approach also, it should help.
Yeah. Thank you, doctor. Thank you.
Hi, I am Raghavendra here. I am father of 4-year. My son is 4-year-old and he is autistic. So doctor told he is a mild autistic. So I'm willing to join some course because I got this link from one of my friend. So can you guide me how I can join course to train myself for my child?
Sure, Raghavendra, what you can do is I am sharing a link in the chat box right now where you can just register. In registration, there are just 2-3 questions they will ask you: your name, your contact number, and email. And we will be sharing information with you on email and WhatsApp as well there.
Okay, thank you.
All right, so I've just shared my contact details in the chat box also, and another link, that is www.jkphealthcare.com/register. So you can click this link and you can register yourself so that your name and number comes in our list, and we will be sharing the course parent training program list there. Okay. Ma'am, we have some questions coming up in the chat box also, which I think we should take up. There is one question from Riddhi that says, as some child can't speak, can you suggest some ideas to know what is the problem with the child? Yes, ma'am. Would you like to take up this question?
Sorry, Alok, I didn't catch the question. What was it?
Question is, if a child cannot speak, can you suggest some idea to know what the problem is with child?
We've talked so much about it that, once, like for me, the first thing is to rule out that there is no medical problem with the child, whether tongue-tied or, any of those kind of things. Once that is clear, second thing I want to rule out is the family history. Because just few days back, 2-3 days back only, I had a case of the child where the mother said, I spoke at 5 years of age. So, sometimes we do have. Third is that we would see, we need to assess whether the verbalization is present or not present in the child. Because verbalization itself shows, because sometimes in developmental delay, what happens that the child may be chronologically 4 years of age, but actually in developmental aspect, the child may be even 1 year, 1.5 or 2 years, where a complete sentence formation and all may not be there. Another thing which I really encourage, that sing to your child, sing the poem, say the words, encourage the child with those kind of things, because sometimes any particular tune, words, poems, toys that they like, when they are repeated to them, the child starts picking up. Because then the child, they at least start picking up the, say, one particular word and things like that. So these are the few of the things which I would like to say right now. But definitely an assessment is needed. And as I said, then only one can move ahead. But otherwise, the more you engage in a two-way conversation with your child and the verbalization has come in, the slowly the words start coming in the child. But of course, a detailed assessment is needed.
Thank you. Thank you. I can see another question from Arka Samantha, that is how parenting can help to prevent and in diagnosis and treatment of autism. So parenting, please go ahead, ma'am.
Because, parenting, because we talked about it, but it cannot prevent the diagnosis. Now, Alok, you can start on.
I was saying the same thing. Parenting can definitely help the child to manage autism.
Yeah.
Right?
Yeah.
Once autism is diagnosed, it can definitely help to manage autism. Okay.
Yeah. But to say prevention of a diagnosis, no. We can say, because the diagnosis, if it is coming, isn't it? Because like we've talked about it, it's a neurodevelopmental, spectrum disorder. So a diagnosis is there. We can't say preventive, but yes, the features which are there, they need to be managed with the positive parenting, where, the diagnosis is accepted, interventions are accepted, taken care of, and moving ahead as a team with the therapist. Then the progress comes. But if you, as a parent, start negative parenting, ignoring and all that, or, kind of going by that, no, we'll give it time, delayed, or whatever your reasons may be, you take it lightly, then I would say that will be mismanagement. The prognosis, which could be better, will start looking little more difficult. So there's a difference in the diagnosis and prevention.
Yes. And I'll add up just here, as ma'am just now mentioned, but I want to add up here two of the very common mistakes we as parents do. One is we take breaks from the therapies just to check whether the therapy is doing right or not, my child is performing or not. But trust me, or maybe it's Christmas time, 10 days vacation, we are going to village, so no therapies for 10 days. How much difference will it make? Trust me, as per my experience, if we have planned some goal and child is learning into the structured environment, we are working on IPs, and suddenly if we give a break of 10 days, unplanned break, child goes back almost 20 days. 10 days, which he could have learned more things, and 20 days he goes back. So once he comes back, again, it takes us 1 month to come back on the same day. So 1 day loss is equivalent to 3 days loss. Now, I don't say that you cannot take breaks. You don't have to take breaks. No, you can take breaks, but the break should be planned breaks. Educate yourself, inform the therapist, take the goals from them, take the homework from them, and do that homework at your break time. So the child remains, at least whatever he has learned, he remains still there, doesn't go back. Okay. Now, the second mistake is we say that therapy shopping. So we do a lot of therapy shopping. 6 months here, 2 months here, 1 month here. Oh, I have learnt about ABA today, so let me enroll my child in ABA. For 3 months, my child, or 6 months, my child is in ABA. Then suddenly somebody comes and tells me about, no, ABA is not doing good. ABA is not good. Let me go to CBT, or let me go to some other sort of therapies. And I just jump there. Please do all your research before joining into some therapy sessions. Else what we are doing is we are confusing the child. And interdisciplinary approach is really needed for a child. So else what we are doing is we are confusing the child, and we are wasting on very important golden developmental years of the child. Usual development is till the age of 12 or 11, max 2 weeks. After that, we can bring development in child. We can teach them functional goals, but as the brain is fully developed, and the patterns, the neurological patterns are also developed, so it is very difficult to make much of the changes after that. So let us not waste even a single day for the child from here to there. Let us do our research properly, find the right therapist, and have trust on our therapists. Next question we have here is, cognitive behavior therapy can be an alternative therapy for autism? No. It cannot be an alternative therapy of autism. In my opinion, it is part of therapies in autism. It is one of the components. As I said, the comprehensive development, you need interdisciplinary approach. You need to work on all the areas of development. So cognitive behavior therapy is one of the important therapy, CBT, one of the important therapy which we can include in the therapy plans for a child. But it cannot be core alternative that we don't do anything else and we are just doing CBT. No, it cannot be. In my opinion, ma'am, if you want to say your opinion about it.
Sorry, I was busy typing out an answer, so I kind of missed out. But yes, what I was hearing, the CBT difficult because CBT asks for identification of the irrational beliefs and the way we are going. Now, for an autism, it becomes, I don't see it as a the therapeutic approach to take the cognitive behavior therapy. For them, a simple behavior therapy of reward and reinforcement, simple behavior modification, that works a lot because it is because their thinking pattern is quite different from us. Then it will be just frustrating for a parent or for a therapist who's trying to implement it. That means that we've not understood the modality, the entire thinking system of the child well to start applying cognitive behavior therapy. Yes, it can be used maybe where there's a very, very mild sign of autism and a person is much older, able to analyze, think, rationalize, but not whereas children are concerned. It's not my go-to therapy for children with autism.
Thank you, ma'am. Thank you. Next we have a very encouraging message from Reena Rachapudi that thank you so much, Dr. Alok and Dr. Sanjana, for this session. This session have helped me a lot to understand the basics of autism. This session have cleared most of my queries which were running in my mind from long times. Once again, and regards to you. Reena, a special thanks to you, and thank you all of you who have appreciated the session before in the chat also. But I want to share it with you, Dr. Sanjana, and all of the participants that this session could happen just because of Reena. Reena has been after me for almost a month and a half to have a session like this. And somehow for some Christmas and New Year and my traveling schedule, I was not able to take out the time. So thank you, Reena, so much for, following up and making this session happen. Thank you so much. Next
Thank you, Reena. It has been nice getting your feedback, very encouraging.
Next question we have here from Arka Samantha again. Is environmental etiquette part of environmental analysis and environmental assessment? Environmental etiquette, I don't understand what do you mean by that. Arka, if you can please explain it to me. I can see if Arka is here right now with us. Yes. Arka, you can unmute and please explain to me your question. No, okay. Dr. Priya, is I am second pregnancy, may how much chance? Yes, Dr. Priya, as I said, I don't get much into the reasons why autism has occurred. But yes, this is the time when a parent is planning for the second pregnancy, I always encourage them and ask them to do a genetic testing and find out if there are chances of autism in the second child. So yes, a genetic testing of you and your husband would definitely be recommended at this level. Though I don't prefer, when a child is already with autism. So for that child, I don't prefer getting into the reasons why autism has occurred. But yes, at the time of second pregnancy, to be safe, I would request you to get the genetic testing done for you and your husband and find out if there are chances, any sort of chances for the second baby to be autism. And yes, there have been cases reported where second child or twin children, both of them having autism symptoms. There have been cases. So there are some genetic factors in it. So I would strongly recommend to go for a genetic testing. Who can diagnose virtual autism? Any clinical psychologist who is trained for it, they can diagnose virtual autism. It's not, or anybody who's doing the assessment. It's just that they need to do a detailed environmental analysis and also look into the symptoms. What kind of symptoms are there? It's just a slightly variations which we need to look into. That's it. All right. So Revant is saying thank you to us. Thank you, Revant. Sir, can we get the recording of this session? So recording of this session is not possible to be shared because it's a protocol from JKP and these sessions are live sessions. So recording cannot be shared. I regret to say that. But yes, we keep on doing some sessions like this on different aspects. Next session I'm planning to have on ABC model. I think I did one session in last quarter where Revant was also present. So I would, that's why we have encouraged you all to register on the link which we have given. Most of you have already registered and then you have got the link. So people who have received our communication directly today from some reference, I would strongly recommend you just go on this link which I have mentioned below, jkphealthcare.com/register and register yourself. So whenever we have next such sessions, we will be informing you. Can we get it in Amazon? Arka, again, what you want to get on Amazon, I'm not sure about. Akash has sent an important message. Hello, sir. Can you please suggest some effective methods by which a non-expert can able to build a rapport with an autistic child?
I have typed some answer also. I don't know whether Akash has seen it, but in case he is there, you can add on to it. Akash, can you hear? Dr. Alok can add on to my answer.
Yes, ma'am.
I'm trying my best to answer the chat box queries.
Okay,
Hello?
okay, great, ma'am. Thank you so much, ma'am. Akash report can be built with autistic child gently along with support of people familiar with him. Child should not be forced or pushed into something which makes him anxious. Using his favorite things, a report can be done. Yes, and Akash, I will add on one more thing here. You can probably Google it out or you can, I will be sharing the information in my next session, ABC model. So if you start understanding child's behavior, child automatically connects. So, behavior is a communication, what we have said. So we don't have to be professional to understand somebody's behavior. Likewise, Akash, for your family members, you must be knowing, when your father or mother or brother or sister, what are the triggers for their aggression sometimes, what your father likes or what your father doesn't like. Maybe You reach home at night 11 o'clock, your father doesn't like and he shouts at you, then you don't reach home at 11, you start reaching home by 10, because you have that fear in your mind that your father will shout at you. Similarly, if we start understanding our child's behaviors rather than correcting those behaviors. Now, correction part, the therapies are being driven by the professionals. Let them do it. But for us, as parent or as non-professionals, as you have mentioned, I would say, or non-expert, it is better to accept his behaviors, understand why this behavior is coming. And once you develop that behavioral communication with the child, you will have an amazing rapport. This is the message for all parents as well. It's not necessary that you have to be an outsider. It's for parents also. Don't work much on corrections. Let therapists do it. Take the talk to your therapist and understand what they are doing, why they are doing, and try to involve that in your daily activities. But work more on behavior. Work more on the communication, what child wants to communicate. Because today, what is happening, continuously what is happening, child is here and we are here. We, as in society, you, me, parents, therapists, everyone. What we are continuously trying is, we are trying to pull the child continuously. In the classroom, teacher is trying to pull the child. At home, parents and caregivers are trying to pull the child. At therapy center, therapist is trying to pull the child up. So we all are trying to do that. Rather than the approach by a parent or non-professional could be that you go down to child's level. Let him have that connect with you, that he and you are at equal levels. And then slowly you upgrade yourself. Automatically child will also upgrade. Trust me, this approach works. I have tried it with many children along with the support of many parents. And one of them being Masuda from Singapore, last week only she started working on it. And within 3 days, she has given me very good response. So go down to child's level. Let child have a feel that you and child are the same. And then start taking your level a little up, not child's level. Don't pull him. Once he starts copying you, once he has that communication with you, then slowly go up. When you go up, he will also go up with you. It is like there are some stairs which you need to climb up, right? You want child to go up with you on stairs. Okay. You are standing on the first floor, child is on ground floor. Continuously, you are pulling the child with a rope, or you are shouting at the child and telling him to come up. That is one way. But the other way could be you go down, hold the hand of child, give him that confidence that you and he are at same level. And then you take one step, small step, as per child's capabilities at a time. Maybe you can take 2 steps at a time, but whether the child has those capabilities, no. So you take smaller steps, automatically child will also take smaller steps. And slowly you increase the size of your steps and child will develop. Okay. So that will help you to have a better connect with the child.
Excuse me, sir.
Yeah.
First of all, very thank you, sir and ma'am, for clearing my doubt. I just have another doubt. Just ma'am already mentioned about the behavioral approach that a person can use for autistic child. I just have a doubt whether or not a classical conditioning will be an effective measure to attain a certain behavior pattern in the child.
Yes, ma'am, please.
Sorry, can you repeat the last bit, Akash? I couldn't catch it.
Sure, ma'am. Well, can the method of classical conditioning be used to attain a certain kind of behavioral pattern in the child?
Of course, because that is why I said that more than that the CBT part, we look at the behavior modification part, which is with reward and reinforcement. You identify the antecedent, then you set up, as to the next step, what is going to come, so that the child starts anticipating. Anything that you plan for your child based on the principle of classical and instrumental conditioning, you have to be persistent with it, because till a learning is repeated, then only it will get reinforced. And then slowly you can stop the one step so that the child naturally continues with the step which was to be taught. Of course, the behavior therapy based on the conditioning works most beautifully for shaping their behavior, for changing their behavior, for retaining or for even unlearning from, making them unlearn what is the wrong behavior. Because reward is very important. Anything which they like is used as a motivation for them to do the activity. So a goal is set up, of kind of a warning signal is given so that the child knows that this is what is coming to me. And if it is done rightly, then the reward is given. So like that it is done, and slowly the signal is removed, and then afterward the reward is also removed, because then the act is done anyway. The child has learned it well, and he generalizes it to other activities also. So learning principles are used in behavior therapy for children with autism.
Yeah, thank you,
Thank you so much.
Thank you. So next question we have from Dr. Priya: does using mobile lot in pregnancy causes autism? Again, what causes autism is not yet certain. We cannot comment, but yes, electromagnetic radiation toxicity is somewhere responsible for autism. That is shown in some research. So far, again, it is not scientifically proven, but yes, there might be chances. So let us avoid it as much as possible, but fair use of everything is required. That is my opinion. Is it okay, ma'am?
Yeah, definitely. And I was reading another question where the lady is asked that with the mothers working, the child is put on the top feed, and can the, the formula feed be cause of autism? So again, we come back to that, it has not been scientifically proven that, and that formula milk or MMR vaccination or excessive, use of all those gadgets and all. But let's leave it at may. And these days your choices are limited. More and more women are working because the times are such. So it is not that we can just put it on just because the child. There are so many children I have seen who have not been fed mother's milk at all due to certain health conditions which were there, so that the child could not be fed. So the milk was pumped or given along with the top feed, along with the formula feed, but all is good. So we cannot say that the formula milk is the culprit. No, because the working mothers will be there. They will ensure that their child gets the best health, the best care. So I don't see it.
Yes, ma'am. Thank you. We have next question from Sunil Kumar. My son is hyper and he can't sit in one place for 2 seconds. How to overcome this hyperness? And now he is 12 years old. Is there any specific diet for controlling hyper? Thank you so much, Sunil, for bringing up this question. I had missed mentioning about it. The role of dietitian, which is really overlooked in India, I see, specifically when it comes to autism. All we depend upon is the myths which we just hear from here and there. Okay, if the child is on autism, blindly we start gluten-free diet or casein-free diet, or we start camel milk rather than cow. We stop buffalo or cow milk. And we do a lot of things. We fall prey for the advertisements which we see on Google, peanut butter or butter for autism, or some formula diets we start believing in. Trust me, there is no scientific evidence that this will help any child. Yes, we suggest some children gluten-free diet or casein-free diet where issues are of gut leakage. That can be done only after the detailed assessment. And that too, if we are suggesting casein-free diet, so we are creating alternative diet plan which can balance the nutrients and body requirements as per age. So, dietitian's role is very important. Yes, with the correct type of diet, as you have said, specific diet to control hyperactivity. With the correct diet planning, we can control the hyperactivity up to an extent. Okay, but that is again done by trained professionals, trained dietitians who are trained for autism. For that, JKP Healthcare has brought in India for the first time autism and nutrition therapy. Our first batch of dietitians has already passed out in December. So we have 8 of autism and nutrition therapists on our panel at this moment. So if you want to get in touch with us for diet assessment, you can get in touch for us. But message to all the professionals: kindly find out or connect with the dietitians who are trained on autism, and start referring children to them, because trust me, along with therapies, if we manage diet well, you can see a lot of induced development in the children. Yeah. Any guidelines? Okay. Yeah. Somebody saying something?
Yeah, it's me, Sunil.
Yes.
Thank you, Alok.
Yes.
And thank you, Sanjana. Thanks a lot.
Thank you.
This really helps us.
Thank you so much. We are glad. Swati says that any guidelines for early intervention professionals, please. Yes, not guidelines, but a clear-cut message. Whenever you are doing early intervention, please do include, as I have said, environmental analysis, and look into the area that whether autism is classic or virtual. Sometimes we end up diagnosing classic autism as, virtual autism as classic autism, and we start working in that direction. But trust me, virtual autism can easily be reversed within 6 to 8 months of right approach, interdisciplinary approach, and right therapies. We can see a lot of improvement in the children. So virtual autism is reversible, very easily be reversible in short span.
Alok, I'll quickly like to respond to this question. There is no name for the person. It shows Huawei P30 light to everyone. My son is 22 years old and I'm struggling with his behavior tantrums. He's already on medication. And this I would like to share with everyone, whoever, now there are hardly 39 people left, but the W's of the behavior, because there is behavior what your child is showing, whether temper tantrums and hurting others, is a sign of frustration that he is not able to express himself. So what I would suggest that you note down, you make a note of as to W's, as to what was he doing when this behavior started, where was he, when was this, with whom was he, as much as, because you have to find the root cause, the antecedent, what is the trigger. Once the trigger is found, it becomes easier then to manage as to where the tantrum is coming in. Secondly, your child is a young adult, 22 years of age, a lot of things coming, even the sexual needs, even the, the other needs that a growing adult has, even whether it is to want to be working, to be earning, to be out with the others. So please get the child, I will not say child, but the young adult, the youngster, again reviewed by a psychologist, because there are a lot of facets which change over a period of time. Because medication is one part, but then as a psychologist, once you sit down and we share, we have a look at the child, we understand the child, and then it becomes better for the further management. So I hope it answers your question.
Yes, ma'am. Thank you. We have one question here that my child is detected with mitochondrial encephalopathy, and only therapies will work or anything else? No, in mitochondrial disorders, we give therapies, but along with therapies, there is an important role of medicines, majorly, some kind of coenzymes, Q10 or levicotine. So you need to consult with your developmental pediatrician or pediatric neurologist for it. Without that, you should not start any medicine, but antioxidants are also given. So I would strongly recommend not only the therapies, but yes, support from the medicines as well.
Now, this person from Huawei, 22-year-old, has asked if we can recommend someone that specializes in autism in the Johannesburg area of South Africa. So let's see if we have in our contacts. We'll definitely inform you. I'll be informing Dr. Alok, and further, the message can be passed on. I'll definitely check and let you know.
Sure.
But at times, even an online consultation can be done, so that one gets a better idea and then can be guided accordingly till one finds somebody physically in the same vicinity of the area that you are staying in. So keep an open option. I hope something works out for you.
Yes, thank you, Sunil. Thank you for your kind words, and that motivates us to do these sessions. Thank you, Sunil. Yeah.
So, Alok, I think it is going to be 6 o'clock, and if I may take your leave.
Yes, ma'am. Thank you, all the participants, for being with us and listening to us so carefully and giving us time. I hope we have, though it was a short time, and autism is like an ocean. So
yeah,
if we start talking about it, I think entire life is less. But yes, we have tried to sum it up in a very small, short time. So thank you. And special thanks to Dr. Sanjana Seth. You have taken up time from your busy schedule. I have no words to thank you, ma'am. Really.
Pleasure. Pleasure is totally mine. It's always an honor to be doing anything of this kind. And as you said, it's literally like, even if we can help out 10 people, they'll further be able to reach out to 10 more and so forth. Even if, they've given us good feedback here and they go and recommend us again for another webinar, it will be helping each other. So it's not only us, but it is our audience also who have learned today will share their learning with the others, which in turn will help. So unitedly, as a team, we all can, from whichever part of the world we are coming in, we can do our best. So thank you. It's an honor for me. But now I'll have to sign out, and all the best. Great year filled with strength and positivity till we meet again. Bye-bye.
Thank you, ma'am. Thank you. I have shared the link again on request of everybody in the chat box, and also shared my contact number. You can connect with me on WhatsApp for any kind of support if required. I'll be happy and glad to help you out. Thank you very much, everyone. And okay, I have last one message. Thanks, doctor. It's an honor being here. Rukaya Kamal from Nigeria, physiotherapist. Welcome. Thank you, Rukaya. Thank you for your kind words, and good to see you. There are many, professionals from Nigeria who have enrolled in some of our programs in past. So, and I am soon planning to come down to Nigeria because we are in touch with some of the schools there to start our pilot project of therapy units, that is IDA therapy in Nigeria. Right. Thank you, everyone. Have a wonderful evening and blessed life. Bye-bye.